so much complex system, right, to manage this complete health, health to all. The mission like health to all is it's very easy to say, but it's really very complex to deliver, because delivery is more important at the end of the day, right? For delivery, we have to have a very integrated and collaborative approach to solve this problem or any new problem which is going to come, maybe more than COVID-19 tomorrow.
True.
Right. So,
thank you, Mr. Singh, and thank you, Dr. Subramanian. I think we've been able to resolve part of the problem, and good time for us to start the webinar formally. And I'd like to thank everyone for joining us, our esteemed list of panelists, as well as the attendees this morning for the second in the series of Digital Health, the Future, wherein we are going to discuss bridging of the gap in terms of AI's role, artificial intelligence role in combating inequalities in health. During these COVID times, and of course before that, we have seen across the globe that there have been inequalities in health. And that has been one of the major challenges, whether it is for the highly advanced economies or developing economies like India, or even underdeveloped economies or countries in Africa. This actually brings us into a situation today wherein we are hit by a pandemic, and the entire globe is facing a problem which is common across all countries. Therefore, we see it as a good opportunity to bring all the leaders of the globe together and see how we can actually not only prevent these kind of pandemics in future, but how do we make sure that we are able to give equal access of health to everyone across the globe, across developing, developed, and underdeveloped countries. With a view to deliberate on this, we have a list of very interesting panelists. We have with us today Mr. Mahendra Singh, expert member for digital health, WHO Global Digital Health from WHO Geneva. Thank you, Mr. Mahendra Singh, and good morning to you once again for joining us. We have with us Mr. Rani Shifron, founder and digital health specialist, Healthier Globe from Israel. Thank you, Mr. Shifron, and we look forward to hearing what Israel has been doing and plans to do in the years ahead, being a very, very advanced, technically advanced country. We are also joined by Dr. Pankaj Gupta, the HOD for Digital Health from Access Health International. And we look forward to hearing you as well. We have Dr. N. Subramanian, not only as a panelist, but also as a chairman of the Health Committee of PhD Chamber of Commerce and Industry, and serves as a director for medical services at the Indraprastha Apollo Hospitals. We are also joined by our Secretary General, Mr. Saurabh Sanyal, for motivating the team for today's webinar. Thank you very much, all the esteemed panelists, for joining us. I will just take a moment to give a brief introduction, which may not be very brief though, but because of the fact that our learned panelists have big profiles, which we try to cut it short. So I will start with Mr. Mahendra Singh. He's an expert member for digital health, AI health, telemedicine, and innovation in the World Health Organization, popularly known as WHO, at Geneva. He is a high-growth global driver and world's top 30 most impactful digital health industry global business leader for bringing change in healthcare, with healthcare accessible, affordable, quality health to all globally. As an expert member in WHO Geneva and senior advisor to WHO global partner countries globally, to Ministry of Health, more than 30 countries, including Ministry of Health of Government of India, and as key decision makers globally related to digital health for impactful role in filling a market gap in solving hundreds of complex problems in healthcare system related to public health in prevention, early detection, diagnostics, treatment, disease management and control, quality health delivery for accessible, affordable quality health to all in combating with non-communicable diseases such as the chronic disease and new emerging infectious diseases such as the contagious top 7 deadly virus epidemic pandemic, including COVID-19. He is also an expert member of the COVID-19 Pandemic Management for Operational Planning Guidelines and COVID-19 Partners Platform to support country preparedness, readiness and response to WHO global partner countries globally, including India. He is the CEO and MD and Chief of Digital Health and AI Innovation of Global Digi Health as well. I'd like to go on to the profile of Mr. Rani Shifron. He's been very modest. He's just sent a two-line introduction. Mr. Rani Shifron is the managing partner at Healthier Globe, a medical device, global medtech and digital health hub, and a strategic innovation partner that scouts, builds, nurtures, secures funding and scales up the medical device and the digital health startups, Mr. Shifron. But I know for sure he's got a very, very impressive experience behind that. And we look forward to learning a lot from him today. Dr. Pankaj Gupta, he is the head of department at Access Health Digital and also a non-executive director at Taurus Global Consulting. Geek doctor, visionary leader, technocrat with masters in computer science, bioinformatics, which is bioinformatics and management from IIM Ahmedabad. For over 2 decades, been working with healthcare pharma technology business and healthcare pharma process standardization. He started with running primary care clinics for 8 years before getting into health tech leadership roles globally. Now he's a consultant at board level of healthcare funds and large healthcare organizations. The various milestones which he's talked about he wrote the building design, IT, clinical transformation for 3 large hospital chains in Saudi Arabia. He's also got a genes patent. Satyam Bioinformatics team found unique genes in the malaria vector, among others. He got the top 50 Smart Health Leaders Award, Asia Inc. 500 Pharma Digital Transformation Award, and is also a founder of the LinkedIn Healthcare IT EHR HIS super group, which has about 60,000 members globally. I'd like to read a few lines of introduction of Dr. N. Subramanian, who is the medical director at Apollo Hospitals, Delhi, where he joined as senior consultant urologist in October 1995 and helped to set up the state-of-the-art Department of Urology. The Apollo Hospitals is the largest healthcare group with over 72 hospitals and over 9,000 beds, providing state-of-the-art tertiary care services across 50 medical specialties. He serves as chairman of the Healthcare Committee of PhD Chamber of Commerce and Industry and as the co-chairman of the Health Committee of FICCI and an advisory council member of People to People Health Foundation. He is an active Rotarian and he has served the Rotary International as a district governor and as the assistant regional Rotary Foundation coordinator after serving the district in various capacities. He has also served as the president of the Rotary Education Foundation and as the executive vice president of the Rotary Cancer Foundation. He's a trustee of the NeuroAid and Research Foundation and the Samriddhi Foundation, and is Chairman Emeritus of the Rotary Delhi Central Charitable Trust. So that's quite a mouthful of the reading on the profiles of the very learned panelists we have today. With this, I'd like to request our chairman, Dr. N. Subramanian, to kindly give a formal welcome address to our panelists as well as our attendees. Over to you, Dr. Subramanian.
Thank you very much, and a very good morning to each one of you. You know, it's a great pleasure to welcome, on behalf of the PhD Chamber, our country partner, Economic and Trade Mission, Embassy of Israel in India, and such a wonderful audience, and to be addressed by such experts. Mr. Mahendra Singh, we are really looking forward to understanding several things from you today. Mr. Rani Shifron, I think you bring a lot of expertise in the area, which we are looking forward to. And of course, Dr. Pankaj Gupta. It's wonderful to have all three of you who bring in your knowledge, your wisdom, to be able to integrate where we need to take this forward. So a brief profile to begin with of the PhD Chamber itself. Before I do that, we all heard Mr. Vivek Sehgal is our principal director. And he puts together many of these things with so much ease and comfort. And yet you see the amount of quality work that goes behind all this. The PhD Chamber of Commerce and Industry has been a catalyst for promotion of Indian industry, trade, and entrepreneurship for over 115 years. It's a forward-looking, it's been proactive, and a dynamic pan-India apex organization. It always is a partner in progress with industry and with the government, with a special focus on MSMEs right up to the grassroots level. The current pandemic that we are all aware of has put a lot of strain on the healthcare system. But this is taking place at the same time with a lot of technological optimism and promise. You can't decide whether it is happening in spite of that or notwithstanding that. But the fact is, we are moving ahead. Digitalization is a very important component, be it in health data, in the progress in the pharmaceuticals, medical devices, healthcare industry on the whole. There are several companies we know which are working in areas like telemedicine, artificial intelligence, NLP, and of course, if you look at the COVID literature, no single disease in such a short time has produced so much literature as you and I have been reading. We know that a lot of progress is happening because of technology and its application. So we know that the use of modern technologies and the digital devices is not only changing the way we communicate, it also offers us innovative ways of monitoring our health and well-being. By innovating in digital health, we also realize we are reducing inefficiencies in the healthcare. We are improving access. We are reducing costs and increasing quality care all at the same time, making our health services more person-centric and moving towards the area of personalizing medicine. When we look at the broad areas, if you see, friends, we see 8 technology trends in healthcare, which are advances in telemedicine, the Internet of Things, cloud computing in healthcare, the augmented and virtual reality in healthcare, artificial intelligence, chatbots, data science, predictive analytics, and blockchain. Each of these contributes in a huge fashion to improving healthcare. Now, talking about some of these developments, medical AI solution companies like Uno, they've just obtained a CE mark for 5 of its medical products. University of California uses the AWS cloud to deploy homegrown AI algorithms for COVID-19. AI, for one, holds tremendous promise for transforming the provision of healthcare in resource-poor settings. Many of our health systems and the hurdles associated with these could be addressed by using AI supported by other technology developments in every emerging field. The ubiquitous use of smartphones combined with growing investments in supporting technologies, the mobile health, the electronic medical records, imaging and signal processing, robotic surgery, and cloud computing. All of these provide tremendous opportunities for a continued and substantial improvement in healthcare as we go along. There have been concerns while we are moving forward in the one direction, whether we are addressing the concerns about privacy, confidentiality, data security, ownership of data, and informed consent. So effective implication and progress would require that we are able to address all these effectively. AI is one of the several tools that will certainly help us achieving health-related targets set down in the SDGs, and particularly addressing important matters like universal health coverage. So today, we have such a wonderfully eminent set of people who understand these developments so well that at this moment of a health crisis that the world is going through, we will be moving forward discussing digital health revolution. So ladies and gentlemen, on behalf of the PhD Chamber, I have great pleasure in welcoming each one of you to partner and learn, as I am going to do, from our expert speakers. Perhaps we could begin with Mr. Mahendra Singh. So our moderator will take you forward from here. So thank you, Mr. Sehgal, for the opportunity to welcome all our wonderful dignitaries. I hand over back to you. Thank you.
Thank you very much, Dr. Subramanian, for navigating us and showing us the direction for this webinar and an opportunity to learn for all of us the various aspects of digital health to reduce inequalities in the healthcare delivery. With that, I am under obligation to say that this webinar on digital health, the future, is sponsored by the Apollo Group of Hospitals. And we thank our sponsors for making this happen. It definitely helps in our being able to communicate well with our target audiences. We are also thankful to our media partners like mHealth Israel, Medgate Today, Drug Today, which comes with Medical Times, Pharma Tutor, Crystal Hughes, and Mantra for helping us, as well as our industry partner, VOH. We also want to thank the Economic Division of the Israel Embassy for being a country partner for this particular webinar. Taking the program ahead, we will like to have quick remarks from each of the panelists to start with on the topic of today. And thereafter, we will have some question answer sessions directed at each of the panelists. And these questions could also be coming in from our attendees, and they could also keep sending us their questions in the chat box, while some of them have already shared their questions with us. So I'd like to invite our foreign guest Mr. Rani Shifron to kindly kickstart the discussions with his initial remarks on the digital health, the future, for which talks about, this is our series 2 on bridging the gap, AI's role in combating inequalities in health. Over to Mr. Shifron. Kindly unmute yourself, please. Thank you.
Yeah, okay. Thank you, Mr. Sagiani. And it's a pleasure to be here with you today. And I hope I can share some of my experience, our experience in trying to take digital healthcare as the enabler for providing healthcare to all populations evenly. And what we've seen with, especially with the pandemic, is the acceleration of the adoption of digital healthcare. This is basically one of the best, I think, accelerators this industry has needed, because otherwise it would take so much longer to be able to adapt. And I'm sure my colleague here, Dr. Mahendra Singh, can give his perspective from what they see in the World Health Organization. But what I have seen in many countries, especially in Israel, is technologies which weren't ripe for market yet have accelerated their development and adapted into clinical use quite immediately, starting from remote doctor checkups from the home to many other solutions. I can give it several examples and cases of products, companies, technologies, and maybe we will have some time later for that. But that's one thing that I've seen. Another thing that, I mean, Dr. Gupta and I have discussed several times before is my quest, at least, to see how we can bring technologies into rural areas to be able to provide healthcare for all. And that's one of the main topics I'm working on, is creating ecosystems to be able to bring these technologies to the market and to get quite fast adoption rates and for that. What I have seen in the past few months is the appetite for these technologies. I can share with you a project that I'm in the midst of, taking digital healthcare companies, technologies, products into the Far East markets. Created a launch pad in Taiwan for these companies, and we basically have taken 25 companies into the market in Taiwan, have the corporates and the healthcare partners that are interested in these, adopting these technologies, to be able to take them on, work with them to do the proof of concepts, pilots quickly, to be able to help them get their products to market. This is something that I'm working, hopefully, maybe with your help as well, to doing in India, to be able to help bring and adapt technologies. So again, what I'm saying is, in a crux, is I think the pandemic has accelerated us. I think it's not going to stop. And I think we're in the midst of a very big effort globally to be able to bring these technologies. And I think we're all going to gain from this effort, and we'll see the results in a short time coming. One of the advantages of digital healthcare, it's not such a long time to market as the big medical devices. That's why we're seeing results immediately. Again, is in the example of Israel, we have taken on specific technologies to help alleviate bringing the patient to the doctor and to do most of the tests remotely. And I think that's where things are going. I can share a lot more, but I'll leave some room for the others to share their thoughts as well.
Thank you, Mr. Shifron. Uh, Very key points, creating technologies and the need to take them globally. And of course, the advantage with digital health being that it doesn't take too long to kind of take it to multiple locations. Uh, Very key points. With that, I go quickly to Dr. Pankaj Gupta. You know, based on what our panelists said, would you like to look at the perspective of India, the Indian perspective of actually having these technologies in India, and how do we really react to that?
Sure, thank you, Vivek. Taking forward from what Rani said, actually, the COVID is a situation where it has accelerated what we thought will take many years to happen. And I sort of echo the sentiment that, yes, we could not have had a better accelerator for adoption of digital health. Just a couple of years back, we were debating about how will the digital health standards get adopted, how will the telemedicine get adopted, how will we reach the rural India, is there a lever that is really available? Just about a year back, when I sat down to do a very clear strategy for digital health implementation, at that point in time, we were sort of putting a strategy together for the payer side as well as for the provider side. And what was coming out clearly was that on the payer side, we do have a financial lever in India, which is the Ayushman Bharat. But for the provider side, we really don't have a lever. So, but then thankfully, COVID has emerged as that lever to bring that massive change in terms of, the mindset and the adoption for the digital health. And that includes, artificial intelligence. I started working on, many of these aspects of artificial intelligence long back, started from rule-based engines, graduated to applying machine learning algorithms. In those days, we didn't call it artificial intelligence. The kind of computing power we have today in our, mobile phones is something that didn't exist in those days. So we would do it on massively parallel systems, cluster computing and things like that. But today, the power of computing that's available on our mobile and cloud is something that is unprecedented. And that has sort of changed the game completely. Similarly, on telemedicine, earlier we needed a large infrastructure to put things together. Today, we don't need that. Today, the mobile provides you all the hardware that you need for getting telemedicine going. You just need the relevant software pieces to sort of stitch it together, the algorithms to come in place. Now, since you asked about the India perspective, what has India sort of lacked in digital health is data quality and data governance. It has happened because all the systems were built at different points in time. They were built in different technologies. The standards were not considered. There's no semantic interoperability. Even though there could be a technology level interoperability, there's no semantic interoperability between all these different systems. Because there is no semantic interoperability, you can't bring the data together. When you can't bring the data together, you can't analyze it. And those issues continue to happen. And it's not that, the public health is better than private health or the payer side of the system. All the systems are actually the same, because there are similar set of issues that are plaguing the public health, private health, as well as the health insurance sector. What have we done in this space as Access Health Digital? We've been working very closely with Government of India on one side, with the development sector partners on the other side. And we also run an accelerator program where there are digital health startups working with us to implement many of the digital health standards that have been laid out, namely the National Digital Health Blueprint, which came out in November 2019, the EHR standard that came out a couple of years before that, and the metadata standards, which came out little before the EHR standard, but were notified in 2018. So the government has done their bit in terms of putting all the standards this time. Government has also done their bit in terms of putting the regulatory framework there. Now it is for the private sector and the public sector to go ahead and adopt it. So these are the comments I would have as far as taking the digital health to the masses in India is concerned.
Thank you, Dr. Gupta. I'd like to talk about very quickly the accelerator which has been pressed because of COVID-19, which you pointed out, how mobile and telemedicine making it all the more relevant, and of course data quality and data governance being a challenge in India. So that takes me to Mr. Mahendra Singh. Mr. Mahendra Singh, since you are a WHO representative and you've been working with all international governments, and having Mr. Shifron talk about taking technologies globally, and here we have an India issue. So a quick opening remarks from you on both the aspects.
Thank you, Mr. Vivek.
Over to you, Mr.
Yeah, thank you. Yeah, as Rani and Dr. Pankaj said, rightly, yes, those are really the challenging journey we have been facing during development of digital health, telemedicine, and even in AI health. Because yes, the set goal is to have So the set goal is to have accessible and affordable health to all. But when we go back at the input side, because that is what we are expecting at the output side. But at the input side, we have a lot of challenges, lot of things have to be standardized, optimization have to be done. Many of the things are available, many of the things are not available. And as Rani said, because of the COVID, the technology things are getting accelerated. Yes, that is very true, because I believe the necessity is the mother of invention, right? So unless we have the necessity of technology, whether we create or by surprise, it comes like COVID-19 has come by surprise. No one was prepared for that, right? So now all the technology companies, startups, or government, whatever they have in their mind, or whatever they want to, provide the resources to accelerate these technologies. So now this is the right time, because with COVID, lot of things got hanged up in health system, and the whole world is now dependent on how we should come out of this problem. Because the top rich companies, whether it is in IT or any other sector, many of them are facing big challenges because of this. Social distancing, see, it's easy to say social distancing, but maintaining it, it's really a challenge. Maintaining it really a challenge means, say, most of the work need to be done inside the office. So for the organization also, it is very difficult to maintain those social distancing. And that is why the easiest way is to work remotely at the moment till we come out with some novel solution whereby, yes, without maintaining social distancing also, we are able to manage this pandemic, right? Till then, we have to have social distancing. We have to use various, prevention activities like putting mask, and we have to make sure that everyone should use mask and not just on the mouth, but over the mouth up to the nose covered area, full covered area. And so these are small things, but it makes a lot of difference when we take care of the prevention side. And because prevention is the area which is in our control. But after the prevention, then once it lands into disease area, then it's very difficult to manage. Because this kind of, highly contagious, deadly virus, COVID-19, it is not like, the growth of this kind of infections are going linearly. But, so these growths are going exponentially also in many areas, especially where it is densely populated, whether it is in Indian scenario, if you see, or in other part of world, where there is a densely populated cities, or where there is less control of people management from governance point of view or from other reasons. So those are really the challenges, and yes, with the technology we can definitely overcome. But it is not only the technology that we can overcome these kind of complex challenges, but we have to have a collaborative approach. Getting involvement of each and every stakeholder in our society, in our country, right? Because when we are working in a collaborative manner from the government side, from the corporate hospital side, from individual private practitioner side, and other key stakeholders from the technology side and from investors side also. Because everyone has to jump into this in an integrated and collaborative manner. Then only we are able to deliver the output, what we are expecting as inequality in healthcare or health to all. Then only we can manage. Otherwise, it will be only a dream unless we solve these problems on the ground.
Thank you, Mr. Singh. Input challenges, standardization, key points which we need to really work upon in India. And of course, as you rightly said, technology alone cannot do everything. We need a lot more collaborators and stakeholders to work with and on it. I'd now like to kick off the Q&A sessions with the first question being directed at Dr. Subramanian. Some of these questions have been shared by a lot of our attendees in advance. So the first question to you is, Dr. Subramanian, what is the role of artificial intelligence in digital health? Because it's just one of the technologies or one of the parts of digital health. And which aspects of AI need to be developed further?
Thank you very much. I think, it's been excellent that I have learned a lot from even the introductory remarks of our wonderful speakers. When we look at healthcare and the role of artificial intelligence, if one were to look at as somebody providing healthcare, what is it that I want? One, I want to optimize my systems. I want to improve the outcomes. I want to reduce the rates of error, and I want to reduce the costs. This would be my basic wish list if I were to approach the whole subject from the perspective of a healthcare provider. Now, let us look at what is available in terms of, most people, the healthcare delivery, whether it is medicine, medical people, associated technologists, most of us come from a background of science, and yet we have been probably among the slowest in adopting digital technologies for a long time. Even in the developed countries, you see, I understand healthcare systems which have adopted digital technologies adequately or beyond a particular point is under 15%. 7 to 15% are the conservative estimates. So there is tremendous solutions available which we probably have not used. So let's look at some of the areas where this becomes important. One, the healthcare itself is becoming more of an on-demand health system. People are looking at seeking medical help or medical advice based on their conveniences, based on where they are located. And our previous speakers all pointed out the value of accelerating the advances in technology. The telehealth, telemedicine as a source of consultation has been available even within our own hospital group. Apollo Group launched this way back in 2005. And yet I find the rate at which we probably developed it and utilized it in the last 14 years is probably less than what we have done in the last 6 months. So here is an opportunity which we have really utilized it very well. Secondly, it's a question of people. When you or I look at seeking out the best hospital or a best doctor or the best possible treatments, I'm going to look at the web today. 52% people seek their medical opinions based on web browsing, and 72% would seek their medical appointments through these. When you look at transfer of images, be it on the internal systems of packed images or satellite transfer of images, which has made interpretation of data so much easier at a much higher level of expertise. Secondly, when it comes to the role of analytics and data, I think, Dr. Pankaj Gupta brought out very well 2 important points. The importance of bringing out the data in a clear fashion, data which you can evaluate and analyze. So I think the concept of the big data coming in and the ability to apply analytics in a big way, I think is the way forward. For instance, if you were to look at analyzing the available data for a given population, the Indian subset of the population, what we may discover in terms of the risk stratification, etc., would be very much different from a different population for which you may have data available. Thirdly, predicting health comes at 2 levels. One is to predict potential health problems that might happen to a given population. But more importantly, it also helps you to predict the manpower requirements at different areas at different times. So if I'm running an accident and emergency services in a given part of the city or the country, I am able to evaluate what is my likely requirement. Today, I think AI can even help me determine at the end of 2 months or 3 months, what is the likely areas where a significant local infection or an epidemic, or even predicting a potential pandemic might be possible. So I might be able to regulate and generate my healthcare mechanisms better. The role of artificial intelligence and VR has been again tremendous. The introduction of robotics into surgery has made things very easy for many of us. As a urologist, I can tell you one of the biggest advantages that we have benefited from is technology. See, I, as a surgeon who has been in the business for over 40 years now, I can tell you, if I have improved my own ability by about 10% in the last 40 years, my ability to deliver has improved probably 400,000 times by any kind of technology, be it develops in fiber optics, be it improvement in lasers, be it improvement in the robotics. Simulated training has made so much difference. With simulated training, my own skills have improved quicker. My ability to transfer that technology to my trainees has become so much quicker and better. So I dare say today, somebody who joins me to learn technology, a younger person, who's probably quicker on the skills of technology, at the end of 2 or 3 years, I can assure you he's going to be better at a given technology than I can be. So that kind of training in the past would have taken much longer. So we know today that most surgeons who are into applying the training based on virtual reality and AI based and robotic technology, we are able to operate and we are able to take off close to 29% of the operating time with training and much less chances of error. Errors have always been something we got to look at with a lot of conviction because we can't afford errors. So I think that's another area which has come to. But I think one of the most important areas where we were moving forward is the areas in relating to precision medicine. With the introduction of AI, if you see the way drug development has developed, if you look at the traditional methods of, creating a new drug and taking it through the initial steps itself, the application of newer technology makes sure that we are able to bring a drug into the market by at least 4 years quicker, and possibly 60% of the investment in cost would have come down. So, which is going to again bring up the important aspect of the ability to access these technology and the affordability to countries like ours. Secondly, when you look at the role of medical genomics is going to play a huge role in deciding how we're going to decide on things like specific treatment for specific conditions in individuals of a given demographic background with a particular illness, etc. around. And lastly, but not the least, is the way the electronic health records is going to change, we're going to deliver medicine. Today, people are traveling a lot. People need to be accessing healthcare not from the same family physician or from the same hospital or the same doctor. So each of us is able to carry the entire electronic health record of ours along with the solutions in our palms. 60% of us are able to carry all the information that we require about our own health records and the health requirements which we need to seek out wherever we are. So at the palm of our hand, we have the whole world of an axis. So broadly speaking, I think that is the width at which AI comes into the role of health. I mean, not to mention the chatbots and their role in diagnostics and other things. So briefly, those are my thoughts, Vivek.
Thank you. Thank you very much, Dr. Subramanian. Clearly spelling out that you'd like to have AI help you optimize system, reduce errors, which we cannot afford, especially being in healthcare industry, reduce costs, of course, making it more accessible and reducing inequalities. And beautifully put, how AI can be combined with the other technologies of digital health to deliver the end result. I'd like to take the next question to Mr. Mahendra Singh. Mr. Singh, my question is, what are the initiatives of WHO in the field of digital health globally? And which are the most successful countries in terms of implementing digital health?
Uh, yeah, in uh, global contest, if we see, yes, in WHO we are working lot many things with WHO global partners. We are learning from different countries, global partners, about their ground realities, and accordingly we are, bringing the recommendations, bringing the standardizations, so that the right set of digital health data sets, digital health complete system we should be able to adopt, seeing local settings, because every country has different challenges, and the same set of rule cannot be applied for every countries. Some of the developed countries, they already have well organized standardization in terms of data availability, in terms of technology availability. But there are many countries who are still learning. They are still in a situation, they are optimizing their maybe the EHR records, or maybe their standardization, or their regulatory point of view, from patient safety point of view, data privacy point of view. So those things are still not has come to the final stage. Many of the things are still in the pipeline, and very soon we will be coming out with the clear roadmap for different countries wise. We are developing, working hard together with our internal team and external partners on this digital health, AI, and into complete telemedicine system. How and where, for what kind of treatment area, how to apply and what to apply, uh, what kind of things we should go for prevention, what kind of things we should go for NCD diseases, what kind of set of technology we should use for communicable diseases, for pandemic, for epidemic, or for other disease management. So a lot of things we are working out, and we are working very closely with the various countries' government on this issue. And I think very soon we will be coming out publicly also what should be applied with which country, what should be the right strategy for every country, local setting wise. Because we cannot have a same set of rule for every country, right? Because say if you go to say some other low poor countries, like say in African countries, say Uganda, or those poor countries, or some other areas, so they are they are much behind us also, right? And but if you go to a country like say Japan, or South Korea, or Germany, or UK, or US, or Canada, or sorry, I forgot about Israel. In terms of technology, Israel is really doing, and it is always ahead. And in my experience, I have been working with many Israeli companies, and I love really Israel, and many of Israeli companies, and their top chief scientists, whether in the military or in the government, they are some of my good friends. So so country like Israel, they have a very well organized structure and system, and a lot of ecosystem is already developed since last so many years, not just today. And I think we have to learn a lot from Indian perspective, from Israel, in terms of digital technology, whether it is for AI, for telehealth, telemedicine, or anything related with technology, how technology can be growth driver in solving real complex problems, especially in country like India.
Okay. Thank you very much, Mr. Singh, for that insight, looking at different models for different countries. And we look forward to the release of the report in a manner which does talk about what should be implemented in which country. Uh, Talking about Israel, which you did, I think time for me to learn from Mr. Shifron. I have a very pertinent question here, which says, what are the issues which Israel faced in implementation of digital health, specifically artificial intelligence in healthcare sector? And what are the learnings you think we can take from for India on that, Mr. Shifron?
Yes, thank you. Maybe I can show it and share with you 2 or 3 slides here, and that will help portray the picture of how we are tackling this and other areas. 1 second. Okay, can you see my slides?
Yes, we can. Please go ahead.
All right. So basically, as in high tech in general, the way we tackle the developing this sector in digital health is by creating a strong, robust ecosystem, which obviously shares and works with other ecosystems as well. But at the end of the day, it starts with the government. Okay, government support programs, just such as the Innovation Authority, what used to be called Chief Scientist, supports and funds and new startups, and government is involved in all aspects of the food chain and getting technologies to market. In some of the groups that are working in this ecosystem is obviously the Ministry of Health. There's a digital health community that is an NGO, a nonprofit that sort of houses all the ecosystem. And there are many different silo, whether it's incubators, accelerators, innovation hubs, and so forth. But it's always looking at what are the challenges and what does the healthcare system need, and then with the ecosystem together, bringing the solutions. What you can see here, this is just a small sample of what we have in digital healthcare. I'm estimating that in Israel today, there are close to 1,000 companies, startup companies, in the digital healthcare arena. A lot of them are still in stealth mode and are not publicized. That's why you don't see those numbers there. But I think as far as publicized companies, there are probably excess of 700 companies. But what we've created is we've created clusters, whether it's in remote monitoring, diagnostics, patient management, assistive devices, clinical workflow, decision support, and so forth. There are others that are not listed here. This is just a sort of a sample. And as you can see, in each one of the clusters, there are several companies operating in those clusters, okay? Some of them you know and heard of, such as Zebra Medical, which is working with the Apollo Hospital as well, in the diagnostics area, TytoCare, which some of you may have heard of, for remote patient monitoring in the home, and so forth. I can bring several examples here, but we don't have all day to go through this. I'd be happy to share more on that with anyone who's interested offline as well. You could see also on brain tech, there's a lot of activities involved here. Most of those, if not all, is all digital health. So we're sort of a leading expert in the world in the realm of brain tech. Okay, and that's because we've created these ecosystems, which, by the way, includes lots of different expertise, whether it's physicians, industry experts, and a lot of these technologies you'll find out have come also from the Army, which have been sort of redone into healthcare technology. And so we're seeing university involvement, we're seeing research involvement, but we're also seeing industry involvement. One of the things that has helped nurture this industry and where we are today is the expertise and the executives which have a long time experience, and they're actually doing this second, third, fourth, fifth time around. So they're already experts. It's taken quite a few years to build and nurture these expertise, and it's probably, it's not probably, it's very different today than where we were 10 and even 20 years ago. Again, if I talk about building the ecosystems and building these solutions, it's all done in clusters. I think that's where the solution is. I think grouping a lot of these companies together, not having each one work on its own, will help accelerate the access to market and market adoption. I think too many startups doesn't do any good for this industry. I think we need to work on clusters. And I think from what I mentioned before, the only way to get this to market is to be practical. Find the partner to do the clinical validation, find the strategic partners to do the distribution, and then find the investors who are willing to invest in this. And that's the sort of programs that we try to do with the Launchpad program I explained before. And this is something I would eagerly want to do in India as well. So that's, I hope, answers the main questions. Again, I can spend all day on this. Sorry, if you like, but I'll leave room for other panelists and additional questions as well.
Thank you very much, Mr. Shifron. I think very interesting presentation, clustering being the key to have a more focused approach in both healthcare systems and patient care. Very thoughtful way of going ahead without really having too much of clutter with too many startups, as you said. And yes, we will come back to you with this. And since you expressed the interest of, expanding into India, we would be definitely having a lot of attendees here who would want to know more about it, and I'll come back to you for that. I would like to now go to Dr. Pankaj Gupta, that in case you can give us an idea of, how AI is being used in US healthcare, because you have that experience, and even though Dr. Subramanian said that advanced countries have been only able to penetrate digital health only to the extent of 15%. And with that, I like to combine a quick question also on the current roadblocks in implementing digital health, which you did talk about in the healthcare sector in India. But if you could give us a good comparison as to between US and where we stand today, and we could probably try and fill in the gap through Israel. Over to you, Dr. Gupta.
Thank you, Vivek. I will try to bridge the gap, as you mentioned. So, long years back when I sort of started digital health, most of my experience in the initial set of years was in the US and Canada. And there we did apply, in those days, we didn't call it digital health, by the way. It was called IT in healthcare. And we worked on, like I said earlier, rule-based engines, and then graduated to machine learning. And this machine learning was on very large, massively parallelized systems, clusters, uh, even supercomputers. So that is the reason it didn't percolate down into the masses. So very rightly said that, it didn't get used to the extent that should have been used. But then now with the computing power that's available, the ability to bring all those innovations down in the palm of the hand, as Dr. Subramaniam said, has become available. So in the US, some of the things that I'll pick up that I have worked on in the past and try to relate it to how that can and is already beginning to happen in India. So again, Dr. Subramaniam mentioned a lot about genomics, drug discovery, clinical trials. So I was fortunate to work on it in the US at a time when the Human Genome Project was just coming out. I also had an opportunity to work on the Human Genome Project, and then after that in bioinformatics space for the drug discovery and clinical trials, a lot of artificial intelligence got used there. Like for example, trying to find the drug molecule that fits onto the drug target, like a lock and key mechanism. So, what is the best fit was done by very sophisticated machine learning algorithms. And I worked on those in those days. Of course, those machines were very large in those days. Today, you can do the same thing. We called it the in silico analysis, where you can do it on very small computing machines. Even mobile has the computing power, which in those days didn't exist. Um, in terms of clinical trials, predicting adverse drug events well before it actually happens in clinical trial, that's of huge value. And we applied artificial intelligence to that and said, can we sort of predict it based on the past adverse drug events that have happened? So another area was evidence-based medicine. Artificial intelligence can learn the clinical rules, the clinical protocols, and then it can sort of look over the shoulder of the doctor and tell the doctor that, maybe there is ABC things that you may want to look at. I worked with an organization called Cerner, and Cerner used to specialize in that space and then later on I implemented Vista. Vista is a very large EHR system, where, these are the systems that have a lot of intelligence built into it, but they're rule-based. What has happened over time is they have incorporated the artificial intelligence inside it, and it's become even more powerful. So, there are universities like Cochrane that continuously produce these clinical protocols that get incorporated into artificial intelligence systems in evidence-based medicine space. Disease management is another area that I've worked on. This is personalized alerts and reminders for the patients to comply to the drug regimen. So what happens is people fall off the treatment protocol because they feel, I feel better, or sometimes they may not have the financial wherewithal to be able to comply with the disease protocol and complete the entire regimen. Or sometimes in chronic disease, it has to be lifelong. So there is a continuous reinforcement that is required, and a very personalized alerts and reminders have to be given. I've worked very extensively in terms of figuring out how it can be personalized, but also not an overload. Because if you keep continuously sending alerts and reminders to the patient, they will switch it off and say, "Bas ho gaya," that sort of a thing. It shouldn't reach that point. It should be useful for the patient. In terms of signs and symptoms analysis, as I mentioned, Cerner, Eclipsis, Vista, they collect a lot of clinical notes, but when they store it, many of these systems store it as text. So then later on, if you have to analyze, you have to do text data mining. I did a lot of that text data mining using machine learning algorithms to find patterns in the clinical notes. Epidemiological studies. Today we are dealing with corona. A lot of epidemiological studies can be done using AI, and I've done many of those in the past. I'll pick up one example. I got tuberculosis data in the US. By the way, US has very little tuberculosis, but I was able to get it in one of the research. And then we applied algorithms to it. We found very interesting patterns that there is a seasonal variation, there is a racial variation, there is a gender bias, and all that. So just an example that a lot can be done in that space. And I can go on with examples, but let me switch to India. What are we trying to do here in India? And as I mentioned that we run an accelerator program under Access Health Digital. We're working very closely with Government of India on the digital health standards, and we are trying to bring out the standards to be usable. So we are building the building blocks. We call it the building blocks, which are e-objects and minimum viable product definitions. We published all of that in the open source. And in the accelerator program, we have 25 plus digital startups working with us. Now it is merging back to back with the government program. National Health Authority runs a program called Market Access Program, under which there are 20,000 hospitals which are Ayushman, under the Ayushman Bharat. They're all sort of, so this entire thing is coming together back to back. And now the methodology that we have used in our social entrepreneurship accelerator is getting implemented in the MAP program. So these 25 digital startups, many of them are implementing artificial intelligence. I'll pick up a few examples. Like for example, there's a startup with us called Artivatic. They are applying artificial intelligence to the payers in terms of onboarding, payment, smart underwriting, collection of claims, automation of claims, reinsurance, insurance, brokers, TPAs, the entire revenue cycle management. This becomes extremely important because we are now trying to do the same in India for the PMJ. We call it the PMJ 2.0 platform, where we have applied the payer side e-object as a viable e-claim. That earlier you were filling a claim form, which was a very elaborate form. Now you don't have to do that. Here is an e-claim object that will plug in into your hospital information system. It will pick up the relevant part of your e-discharge summary, and then it will carry it forward to a platform, which is the health claim platform. Health claim platform will have artificial intelligence and rule-based engines embedded inside it. It will know how to process that claim, and then it will send it to the relevant payer. Like for example, under PMJ, you have 33 states who have signed up. Each state is a separate payer. They have their own set of rules. Each one has a different sort of coverage. Some of them are covered extensively, as in they're covered like everything covered. Some of them have a coverage limit of only 1 lakh. And then there are others who are saying that the entire population of the state is covered. So, those rules vary. And what this health claim platform helps you do is figure out what is the coverage, how much is allowed, what is the package that is involved. And then, without a human intervention, it is able to sort of process it to a large extent. Now, this is a design which is in place. In terms of implementation, we are taking the first few steps to sort of take it forward. And the design is ready as far as the country is concerned. But then in terms of implementation, some of these building blocks are falling in place. Another one is Avid Data Sciences. Avid Data Sciences works with us on implementing artificial intelligence for analytics and big data. So they pick up the clinical data and they pick up the insurance data, they analyze it in terms of trying to put pattern recognition algorithms and trying to find patterns in this big data. There's another very interesting startup that works with us called Raksa. It uses an artificial intelligence to translate the text and audio for diagnosis, for chief complaints, and for prescription. And it also sort of builds in the standards. The SNOMED is built into it. And all the code sets, which are ICD-10 and LOINC, and all the code sets are built into it. So the doctor doesn't have to do anything. Doctor just has to ask the Raksa platform that, these are my signs and symptoms. Tell me how will it be taken forward? And the system will say that, okay, this is the diagnosis. This is probably the relevant treatment protocol. Now it's up to the doctor to decide whether to take that or to sort of, put a treatment protocol of his or her own. So that's a very interesting one. I'll take one more and then after that stop at that. There's another one called POKTER, P-O-K-T-E-R, POKTER. It's a relatively new one that joined our accelerator. Works on an artificial intelligence-based system for symptom checker. So all the symptoms are checked. And it also applies to predict the disease patterns in the practice. So you can apply it at a individual doctor practice level or at a population level. So it will sort of do a predictive algorithm for disease patterns. Of course, COVID is accelerating the adoption of digital health, as we have said. So these were startups that were sort of struggling in terms of how do we take it to the masses in India. But COVID has really helped us open those doors. And we are seeing, earlier we were pushing, now we are seeing inquiries coming in saying, can we have a system that is standardized on the digital standards which the government has published? So, things have really begun to change. I'll stop at that and, over to you, Vivek.
Vivek? Is Mr. Vivek there?
Yeah, sir, I think Mr. Vivek Sehgal sir has some problem with his internet connection.
Okay. So are we through with the whole thing?
I'll do one thing, sir. If you permit, I'll ask the next question.
Yeah, please.
Yes, sir. My next question is for Mr. Mahendra Singh, sir. Sir, we need to know that what is the role of artificial intelligence in global health and how we can bring down the inequalities in health. You may see there are a lot of inequalities in health and how we can bring it down with the help of artificial intelligence, please, if you can elaborate on that. You are muted, sir. If you can please unmute yourself.
Yeah. AI can really bring a change in terms of bringing healthcare to all or equality to all in terms of healthcare delivery. But the challenge is how you are going to get this, because at the input side you have many things, because AI is not something which you dream and it will deliver. AI is again a software technology where you have various data modeling from the perspective of mathematical data modeling or from analytics, from data science, from data sets, what kind of data sets you are creating, what kind of problem statement you are having, what kind of data quality you are having, whether you have the data the required quality data or not, because it all depends on
There's some background people can mute.
Yeah, you can go ahead, sir.
yeah. So so the output is the what is the problem statement, right? Output is that we want to have equality, but to reach that output, there are lot many things on input side, and output is dependent directly on the input side. Output is not like you put 0 at the input side and you expect that 1 should come out of the AI. No, it will never come, because it is directly dependent on the input side. If you don't have a right data set, if you don't have the quality data, if maybe you have a data scientist, but he don't have the knowledge of how or what has been decided at the clinical side, what kind of expectation the clinician or the medical researchers are expecting from the data modeling, right? If that is not as per the medical researcher or as per the clinical practitioners, right? So whatever data scientists are going to build, that will be useless, because whatever data scientists need to build, that has to go as per the expectation of the clinician, because ultimately whole model has to work as per the practitioners, as per the doctor, because he's basically expecting that it should deliver this, the automated system should deliver through AI this kind of outcome, that kind of outcome. Not that the AI data scientists, they are going to decide, no, it can do whatever input you give it. We are the smartest people on earth, so we are able to do irrespective of input data. We can deliver whatever you are dreaming. It cannot happen like that, right? So that data, because it all depends on how you are doing the data modeling, what kind of data points you are having, what data quality you are having, whether your data is really workable for making the AI modeling or not, right? So these are so many factors which have to be taken into account, because AI is like, I would say, it is like a carrier, right? But carrier, like it is an horse, right? But horse has to move as per the horse rider, right? Horse cannot move as of its own. So horse has to go as per the rider. Where rider want to reach that destination, horse has to take this thing to that side. So the output is dependent on what doctor is expecting at the input side. It is not that what AI data scientist is expecting, or what, like if we blindly, or if we blindly trust on data science or data scientist to deliver what you are dreaming, it is really impractical, because you have to go practically what practitioner is expecting, what validation he want to have. As per that you have to do. Otherwise what will happen, a data scientist, because data scientist is having this mathematical model, he can change the variables, he can change the variable, he can do a lot of manipulation to deliver what you are dreaming. But at the end of the day, we don't want manipulator solutions. We want the real solutions which are at the input side, and which are already created by not the data scientist, not the AI scientist, but the medical researchers. Because ultimately they have to use the whole AI solution, not that data scientist. Because data scientists, they are developing it, but they have to develop as per doctor's demand, as per doctor's experiment and research, what he's expecting. So that is the thing. And if you talk about, say, coming to the data side, say, like if you see a country like in India, we have a very, I think, complex problem related with the getting the data. for doing this data AI modeling, right? And I think government have to move fast on data sharing with the data researchers, with the data R&D companies who are working into AI health. And because what is happening, like most of the time, like government has a lot of data, but it is not in proper use. And the clinical data are so powerful that if they are shared with these AI researching companies, you can solve many problems. We can solve COVID-19 pandemic, we can solve cancer disease, we can solve all different types of disease. But these, the data records which are with the government or with any government or private hospital, that has to be shared with these, research AI health researching companies. Because ultimately, today, if you share this data with these companies, tomorrow they will get back to you with some solutions. But if you only figure about, that, no, we have to maintain the data privacy and we will not give it, then you are making a big mistake and you cannot improve the healthcare system at all. I do understand and I really support that we have to have a data privacy policy. I don't say sharing doesn't mean that risking the data from privacy point of view. No, we have to maintain data privacy as per the National Data Privacy Policy and Act, and from the patient point of view. But there is a way to annotate those data. Those personal information of the patient can be annotated so that those all, because we have tons of data with the various hospitals all over India, private, government, right? Some data are already centralized, some are not centralized, some are still with some hospitals and government system. But the problem remains the same, that it is not in use properly. It is just, they have the data, but of no use. So that has to be bring into actionable data. Because only with actionable data, you are going to deliver and solve these, present and past problems and any future new problems which are coming with using of this AI and telemedicine innovation. Otherwise, we are only dreaming without, if we are not focusing on how to leverage the uses of, sharing the data with these companies. But what is happening today, it is unbiasedly shared with some companies because of some interest, self-interest or whatever interest, but it is not done as a system policy. It should be totally transparent. It should be given to every company, because at the end of the day, this research company, what they will do, right? They will come out with some of the other research outcome, which are going to be helpful to government of India, to corporate hospital, whoever are sharing the data. Because data sharing is a major, I would say, roadblock in building a good AI model. Because data sharing, data standardization, data regulatory. So these are some of the major, things which have to be taken swiftly action on this for sharing the data, so that we can solve many problems. It is not only related with the COVID-19 pandemic management, but we can solve many our existing problem in our, healthcare system. Whether it is for this disease or that disease, we can solve every problem. So we have good data scientists, we have huge human resources, but we are not using them in right direction. We are not funding the these AI health researching companies or startups effectively. Many of them, they are not getting funding. So those are the challenge. So how can you expect this dream statement of inequality if you are not solving the problem at the input side? So I think I recommend Government of India and all the corporate hospitals that they should come together and be swift and smart enough in sharing this data, subject to maintaining the patient data privacy and as per the National Data uh, uh, Data Sharing and Protection Act. So this is, I think this is very important, and this will help everyone. And if you see in global terms, like globally, since we have a large population, so we can have a huge data related with healthcare. And we have many problems existing in our various disease, right? From prevention to complete disease management, right? So the same data tomorrow also, or the research outcome, what AI health research companies can bring out, that can be used for other countries also. Even it can be used for the WHO, because we can do a better governance, we can do a better recommendation to all WHO partner countries. So that is why this kind of integrated approach have to have. Then whatever you dream, the title of equality and health to all, that can be really easily can be delivered. Otherwise, till then, whatever we are saying, it is really becoming only the dream of in digital health, but it is not coming on the ground, because we have to bring this on the ground, and we have to take the right set of stakeholders in involving in terms of making the policy making at the government level, at the state level, at the national level. That has to be there. I think this is what I want to say, Mr. Vivek.
Yeah. Thank you, Mr. Singh, for that passion and emphasis on data sharing being key to any data analytics and predictive analysis to be done, and how it can help the entire global healthcare ecosystem, one country learning from another. Very important that we look into something like this, which can help bring health to all, as you said. Before I go for a quick round of a last question, for which I will request all panelists to give very quick answers, because we are running short of time. It is basically the last question to Dr. Subramanian. Dr. Subramanian, my last question to you is, at what level does Indraprastha Apollo implement digital health? You did talk about what you did in 6 months. You have not done it in the last 15 years. But how do you see that happening now from here on across your chain of hospitals? And how do you think you will change in the next few months and years?
Yeah. You see, what I mentioned about the telemedicine or teleconsultations, video consultations, was something which has accelerated very well. While on the other hand, when you look at how we have applied digital health and AI-based technologies in our hospital system, one is a large electronic medical record database, because both in terms of treating patients, because we have over 72 hospitals at present and over 9,000 beds. So we have the tertiary care where we are treating several large kind of conditions. Like we are the largest single solid organ transplant hospital in the country. But we are also the people who have been looking at preventive health in a big way. The health checks, which give us data across individuals who are otherwise healthy, who are only coming for a preventive check, it gives you a dimension to look at in terms of the country's population. We have done over 20 million health checks in this part of the world. So as Dr. Mahendra Singh was saying, the data which is captured in a structured format into the electronic records would be the basis for good analysis. It creates a personal health record with an element of a hybrid cloud computing model and with mobility applications. So consequently, you are able to use this to even stratify the risk of an individual to potentially developing or otherwise of a disease conditions. Similarly, we are able to monitor the outcomes at various setups. There is an ongoing audit, an ongoing medical outcomes program, which is benchmarked on what we call an Apollo Clinical Excellence score. For instance, the length of stay in a hospital after X surgery would be compared with a benchmark like either the Cleveland or the Massachusetts or the Mayo Clinic, so that we know that we are not only delivering good clinical outcomes, we are also making sure we are doing it efficiently. Secondly, we have the Apollo Prism, which is a mechanism across the board of all the hospitals of accessing somebody's clinical reports and diagnostic evaluations, etc., on a single platform, where you have an individual has an access to all his medical records and reports, so that whenever he needs it, the details are available. Thirdly, the introduction of the 24/7 consulting program, again, is an extension of the telemedicine, where there is a potential for either an audio or a video consultation with potential to share all the reports which have been done, with a potential to a chat or a video consult, all built into the convenience of the patient. Fourthly, we have something called a Pro Health, where individuals who regularly undergo a health check, they not only have the data available, we are able to compare the data of, let us say, the last 3 years to see whether the advice and the interventions are making a difference and improving the potential quality of health. So we are able to say with these interventions, whether they could be interventions in terms of diet, medication, exercise, or other advice, to see whether the potential for developing a given disease or a potential for abnormal reports can be brought down by these advices. The other two areas, which I think again was brought out very well, I think by our previous speakers, for a large hospital like ours, which also has people in training and large number of patient base, the creation of good algorithms becomes very important. Algorithms are the best way to make sure whether it is myself or a person with 10 years greater experience than me or 10 years less experience than me is able to deliver the same quality or the same standard of care without relying on subjective factors. So algorithm-based medication becomes much safer, much more standardized, and the outcomes are likely to be better. Lastly, on the cancer care, when we look at it, we have these multidisciplinary tumor boards in our hospital, where the surgeon, the radiation, and the medical oncologist will sit together with the reports of individual patients and decide what is likely to be the best quality care that can be offered to this patient. And the data which has been fed into this model of Watson's is able to give you a solution which it considers the appropriate solution for this given patient with this given data. So we are able to evaluate our own decisions based on so many years of experience to see whether the objective data that is being reported by the application or conversion into an ML would be able to offer the same solution. So these are some of our initiatives, but we are very keen to take this forward in a much larger scale. And both, I think Dr. Mahendra Singh and Dr. Gupta earlier pointed out the value of structured data is one of the biggest benefits of digitized formats of documenting history and examination findings. And that alone would give us many solutions, many solutions which would be appropriate. And that would make the interventions much more cost effective and would have a lot of focus on preventing disease rather than just treating disease. Those are some of my thoughts.
Thank you. Thank you, Dr. Subramanian. And I think a lot of these thoughts and plans of action, which are already actioned, as well as what you plan to do, will definitely take the digital health forward. And we look forward to a system where we can look at creating more data, which you are as a private entity creating. And the call of Mr. Mahendra Singh to the government and the private sector to share data for more artificial intelligence-based analytics to happen. So my quick last one round of same question to all the three panelists. I'll first go to Mr. Rani Shifron. I think a lot of attendees wanted to know, what could be the way to tie up, since you also expressed interest of coming to India and bring a lot of these technologies here. So they want to know how can they tie up with the companies in Israel and also have some kind of technology tie-ups for the startups in India.
Okay, so there are many different ways to do that. One of the programs in place is an Israel-India collaboration program, is sponsored by both governments. Basically, each company submits to their own government body for approval, and they would get funding from their own government body to be able to do that. In Israel, it's the Innovation Authority. That is one way. Another way it would be to directly collaborate with the companies on a private basis with no programs involved, and just to see who's a good fit with each other. And so that is another way. I think the best way in order to scale this sort of activity, again, from my recent experience during the pandemic, which we brought 25 companies to Taiwan, that is definitely scaling, is to get the government involved, to get the private organizations such as Apollo, healthcare organizations such as Apollo involved, to do the clinical pilots, and to get the industry involved as far as distribution solutions. Part of the success that I've seen trying to make this all practical is to have the end users, the customers, such as Apollo, bring up the problems or the challenges they have, and we can then tailor make solutions, whether it's with one company or a combination of companies and technologies. And that's the quickest way I've seen to make this practical. Now, this is taking companies from Israel to India, but it's also combining solutions from India. We can do this in many different ways, but we do need the government involvement to be able to drive this. Government involvement, but having the private sector run this is the quickest way that I've seen. I think that, again, I concur that this is bringing about a new era of precise and personalized medicine, and we'll see more of this. So I think that's where we need to strive for these sort of solutions. And I'd be happy to discuss this with anybody interested.
Right. Thank you very much, Mr. Shifran, for this. There was a parallel question on this itself, which I'd like to address to Mr. Mahendra Singh. If you can quickly tell us how would Indian companies who are interested in this, how can they tie up with WHO or something on these technologies which they may have?
See, as a standard, WHO works with different countries' government, which are WHO partner countries, directly with government. They normally don't work with individual companies, private companies, because of various reasons. So, if at all there is any company they want to participate, they should get connected with the local government within our country, and so whatever they want, they have to get from local countries, because WHO is a global organization and they work only with the countries, not with individual part, private corporate companies. So that is
Thank you. Thank you. And I'd like to now put this up to Dr. Pankaj Gupta. Scope for collaboration for companies who are attending or would want to, get into digital health, may have solutions or may like to collaborate. Would you like to suggest something?
Sure, Vivek. Thank you. As I mentioned, we already run an accelerator program. We are an NGO. We are a not-for-profit entity. So we run an accelerator program. The way it is structured is, on one side, it works with the government. On the another side, it works with the private sector. It involves academia. It also involves the research organizations. So we already run that accelerator, and the first cohort is already closed. We have about 25 digital startups working with us. The second cohort is basically coming from the government. It's merging back to back with a government program, as I mentioned earlier. It's called the MAP, Market Access Program. And this market access program will bring in another set of digital startups. So one way is to come through that route. So you go and apply for the grand challenge that is announced, and there will be more routes that will be opened up. So cohort 2 is going to be mainly through the government. Cohort 3 we will again announce in a couple of months, and more companies can join us. So that's what I would want to say. And to elaborate on that a little bit in terms of exactly what we are trying to offer to these startups, based on the digital health standard that the government has put together, we came out with e-objects. And I already elaborated on one e-object, which is e-claims. There are more of these e-objects, like e-discharge for the discharge summary, e-prescription for the telemedicine prescriptions, and all the prescriptions that come out from the outpatient department, and an e-encounter that is the complete sort of output from a outpatient clinic that has to be referred. The patient has to be referred to a higher center, so that's an e-encounter object. Now what we are working on is applying artificial intelligence to populate these e-objects so that the provider doesn't have to do anything. It will be the artificial intelligence that will pick up the data from the relevant system and populate the e-object. So that is the work that is going on. You're welcome to participate.
Wonderful, wonderful. Thank you, Dr. Gupta. I think I have pages full of my quick notes which I could take down during these discussions, and I'm quite sure I've missed as much as I have written, because we had a fantastic session lasting almost 2 hours, which is tremendous. And I'd like to thank all the attendees for being there. And I'd like to invite our Secretary General, Mr. Saurabh Sanyal, to kindly propose a formal vote of thanks for the wonderful session of knowledge sharing which has happened today. Over to Mr.
Thank you, Vivek. Thank you so much. At the outset, I must thank all our distinguished panelists who have deliberated on this topic of the artificial intelligence role in combating the inequalities in health. I think it's a wonderful tool which has come to this part of our globe, and it is going to make a tremendous, effect on how to deliver other goods and services in addition to the health sector. So my profuse thanks from the core of my heart to Mr. Mahendra Singh ji, the expert member for digital health, artificial intelligence health, telemedicine and innovation, WHO Global Digital Health, World Health Organization, Geneva, for sparing your valuable time and coming to this webinar and attending us and guiding us and telling us about the AI's brutal role, or I would say the proactive role in the health sector. I would profusely thank Dr. N. Subramanian, the Chairman, Health Committee of PhD Chamber of Commerce and Industry, and Director of Medical Services, Indraprastha Apollo Hospitals, for agreeing to give us the opening remarks and the welcome address to all our panelists. Thank you, sir. Thank you for sparing your valuable time and informing us about all the important management which is taking place in Apollo hospitals. I would like to thank from my core of heart Mr. Rani Shifron, the digital health specialist and CEO, Healthier Globe, Israel, for having spared his time, valuable time, and telling us about the activities related to the innovations which Israel is famous for, right from their startups to their every sector, including defense, as was rightly brought out by Mr. Mahendra Singh. Thank you so much, sir, for gracing the occasion. We were really grateful for having learned from you a lot today. And I would like to thank Dr. Pankaj Gupta ji, the Head of Department, Digital Health, Access Health Digital. Thank you, sir. Thank you, Dr. Pankaj, for your elaborate remarks and for your overview of the entire artificial intelligence and the electronic role, digital role in combating the inequalities of health. I would like to also thank the Economic and Trade Mission, Embassy of Israel in India, for their support in the webinar. Thank you so much for supporting this webinar. Without your active support, it was not possible to hold this webinar in such a fashion. I would also like to thank the Indraprastha Apollo Hospitals for sponsoring the webinar and our all media partners, Crystal Hughes, Medgate, Drug Today, Pharma Tutor, Health Mantra, M Health for their support, and our industry partner, Voice of Healthcare, to make this a grand success. Before the world was even aware of the threat posed by the coronavirus, COVID-19, artificial intelligence systems had detected the outbreak of an unknown pneumonia in the People's Republic of China. As the outbreak has now become a global pandemic, today the AI technologies, tools play a very key role in every aspect of the COVID-19 crisis and response systems. Understanding the virus and accelerating medical research on drug treatments, detecting and diagnosing the virus and predicting its evolution, assisting in preventing or slowing the virus spread through surveillance, contact tracing, responding to the health crisis through personalized information, and learning and monitoring the recovery and improving early warning tools. To help facilitate the use of the artificial intelligence throughout the crisis, policymakers should encourage the sharing of medical, molecular, and scientific data sets and models, collaborative platforms to help AI researchers build effective tools for the medical community, and should ensure that researchers have access to the necessary computing capacity. With these words, I once again would like to thank each of the panelists who are here on the webinar with us, and also all the participants who have spared their time and have given a very patient hearing and asked a plethora of questions which were very helpful in gaining additional knowledge. Thank you and Jai Hind.
Thank you very much, Mr. Sanyal, for those vote of thanks.
And notwithstanding Vivek, I would like to thank Mr. Vivek and his entire team for putting this over a number of days. Yesterday also we had a very good session, and today again we are having it. And I think in due course of time we will be continuing to have many more sessions of this nature. Thank you.
Thank you. Thank you very much, sir. And
Thank you.
I'd like to thank Mr. Radi Sheffron, Dr. Pankaj Gupta, Mr. Mahendra Singh, and Dr. Subramanian for being here and sharing so much of knowledge for all of us. And I'm sure in our own ways, we will be taking it forward to logical conclusions to help reduce inequalities in health across the country, across the globe. I'd like to thank my team who has been working behind the scenes on this, Dr. Ravi Rathod, as well as Mr. Amit Patwal and Mr. Siddharth Sahni. Thank you very much, my friends and my dear colleagues, for making this all happen. With that, we announce the closure of this particular webinar and look forward to another knowledgeable session soon thereafter. Thank you, everyone.
Thank you. Thank you
Thank
so
you.
much.
Thank you.